Right. So today we are talking about an important topic for pharmacology, that is regarding anticoagulants. So I am Samir Lianarachi. So when we consider anticoagulant, here you can see the physical process of clotting. So basically I have included simply what is the main thing behind clotting process. So injury or damage to the small blood vessel, then you can see factors are activated. There are different factors for the clotting process, so those factors will be activated. Then blood vessel will be contracted, then platelet plug will be formed, and then fibrin fibrin fibers will be deposited on the platelet and producing fibrin clot. So this process will be explained further in the next slide. So here you can see when a person get an injury. So for the as the response, so there may be step one, vascular spasm. So inside the blood vessel there are smooth muscle. So that smooth muscle will be contracted due to vascular spasm and causing vasoconstriction. Then in the step 2, you can see platelet plug formation. So injury to the lining of vessel exposes collagen fibers. So platelets will be adhered to the area that the damage caused, the injured area. Then in the third picture, you can see platelets release chemicals that make nearby platelets sticky. So platelet plug will be formed gradually. Then final picture, you can see the coagulation process. So fibrins also will come towards the area, and a mesh will be formed. So fibrin clot is produced according to the final image. So here is the chemical process of blood clotting. So I have included simply what is happening here. So if you want to know further deep knowledge related to this, you can refer these areas from websites, uh, recommended websites especially. So simply if I am explaining this, so as I told you, first injured tissue, injury is there, tissue injury, and blood platelets already present inside our blood, as a component of blood. So our liver will produce vitamin K, and especially vitamin K is needed to produce clotting factors. So vitamin K is essential to produce most of the important clotting factors to form the blood clot. So liver produce vitamin K, then blood platelets will be there. So thromboplastin is a component that present in our blood. So platelet when activated, so thromboplastin comes into the action. Then when the damage occur in the tissue, so calcium concentration will be increased. So calcium ions can convert inactive prothrombin into active thrombin. So vitamin K helps to produce prothrombin. So prothrombin is not active form, so it is inactive. Then will be converted into active form called thrombin. So what is the action of thrombin? So you can see here, according to the picture, thrombin can convert fibrinogen, that is also soluble one. That means fibrinogen is also present in our plasma. So fibrinogen will be converted into fibrin, and that is insoluble form, and adhere to the damaged place, that means to the injured place, uh, together with dead red blood cells, dead bacteria, and dead WBCs. So again, I simply explain blood platelets are there. So thromboplastin will be converted into uh, thromboplastin will convert thrombin, prothrombin into thrombin. Then thrombin can convert fibrinogen into fibrin, so insoluble form is fibrin, and deposited with RBCs, bacteria, and WBC. Right. Then here you can see rationale for anti-thrombotic therapy. So that means thrombus is a blood clot. So again, we are talking about uh, anti-thrombotic therapy. So thrombogenesis is the formation of the thrombus, blood clot. So as I mentioned you, vascular injury. So first thing, therapies, different therapies we are talking about here. So first thing, we can reduce the risk factors getting vascular injury. Then platelet inhibitors. So platelet inhibitors can be used to reduce platelet adherence and activation. Then anticoagulants can thrombin generation and fibrin formation will be prevented. And finally, fibrinolytics we can use to activate plasmin, so plasmin generation and fibrinolysis. So that means plasmin can dissolve exactly fibrin clot or preventing occurring fibrin clots. So first we'll discuss about antiplatelet agents. So as you all know, molecules that do not allow platelet to aggregate and thus prevent clotting, especially in arteries, are called antiplatelet agents. So you know, aspirin, dipyridamole, clopidogrel are included into antiplatelet medication group. Then the second drug group, anticoagulants. So antiplatelets are preventing activation of the platelets, and that means clotting of the accumulating of the platelets. But anticoagulants, they are molecules that prevent blood from clotting. So they inhibit the chemical process of formation of three-dimension fibrin polymer. So these include heparin, low molecular weight heparin, and coumarin. So coumarins, you know, so warfarin is included into the coumarin group. So, and we will discuss regarding these things. So then, as I told you before, fibrinolytic agents. So the fibrin clots can be dissolved with help of fibrinolytic agents. So examples are streptokinase, you know, alteplase, tenecteplase can be used as fibrinolytic agents. Then heparin. So you know, source of heparin. Source is biological. So heparin is extracted from the biological sources. So there are different types, you know. One is unfractionated heparin, and recently we are using low molecular weight heparin as it is effective than unfractionated sometimes. So here you can see in this picture the action of low molecular weight heparin and unfractionated normal heparin. So below you can see the molecular weight 200, 2000, 5000, 10,000, 15,000, 20,000, 25,000, and 30,000. So you can see When low molecular weight heparin, when the weight is less, that will be distributed in our blood very fast. So you will get the action fast, but the action will be disappeared also faster than uh, weight. That means normal heparin types, unfractionated ones. So therefore, in some cases, low molecular weight heparin is more effective. So unfractionated, it is a major anticoagulant effect by inactivating thrombin, as I mentioned you, the cycle. So thrombin will be inactivated by heparin and activated factor 10. So through an antithrombin dependent mechanism. So basically, we are giving this as intravenous therapy, heparin. So uses of heparin uh, inhibit additional clotting, allowing body to lyse. So current clot treatment and preventative uses in hospitals. We can give heparin in pulmonary embolism when we get blood clots in the pulmonary system. Then stroke evolving patients we can use. Then massive deep vein thrombosis, severe cases, we can use heparin. Then adverse effects, uh, as uh, dissolving blood clots, this can cause hemorrhage, so it's a risk, and we have to monitor that carefully. Then heparin induced thrombocytopenia, then hypersensitivity reactions for some people, as it is a biological source, there may be some hypersensitivity reactions developed. Then contraindications, GI ulcers, blood uh, dyscrasiosis are the main contraindications. Right. So when we consider low molecular weight heparin, so it is never form. So fixed dose schedule can be used at home even, because small injections are there. Subcutaneously we are giving that. So much less likely to cause thrombocytopenia than heparin. Then therapeutically usage, first line therapy to prevent deep vein thrombosis and prevention of DVT following the surgery, and treatment establish DVT, then prevention of ischemic complications. So when we consider adverse effects and interactions of uh, low molecular weight heparin or any kind of heparin, so bleeding is the main uh, complication that we can get. So enoxaparin is a kind of brand also, so can be used as a low molecular weight heparin. So when we consider that single daily dose is given, usually less effect on platelets and reduce need for monitoring for bleeding. So then we'll talk about warfarin. So previously I told, so oral, this is a kind of oral anticoagulant. Previously we talk about subcut, that means injection forms, especially heparin, but here warfarin is given as oral anticoagulant. So this can prevent vitamin K, so antagonist of vitamin K. Therefore, vitamin K related clotting factors will not be produced. So blocks the biosynthesis of factors 7, 9, 10, and 11. So that 2. So that's the main way to reduce the coagulation. So anticoagulant effects occur 3 to 5 days after oral use. So it's not faster like heparin, but this is also effective to maintain continuous therapy. So no effect on circulating clotting factors or platelets from this. Especially you have to know this. So warfarin will not give that means uh, on circulating clotting factors, because this is giving the effect on the production of the clotting factors only. Right. So the therapeutic uses, long-term prophylaxis of thrombosis. So therefore it is really good. Prevention of the thrombosis, people can use for a longer period of time. Then prevention of venous thrombosis and associated pulmonary embolism. So prevention of venous thrombosis and associated pulmonary embolism. So prevention of embolism in patients with prosthetic heart valves, especially we are recommending to use warfarin for some period, and also prevention of thrombosis during atrial fibrillation. We can give the patient warfarin doses. So adverse effect, again hemorrhage can be a adverse effect, and fetal hemorrhage and teratogenesis from use during pregnancy. So do not use during lactation. Especially you want to know when people are having warfarin, it should be advised, or dose should be decided by with the help of a consultant cardiologist, because it is a risk factor. If the warfarin dose is high, so the bleeding tendency, internal bleeding tendency will be also increased. So basically INR values, that means international normalization ratios, will be monitored while giving warfarin. So then we will talk something about antiplatelets. So aspirin, clopidogrel, and dipyridamole are included into that drug class. So here you can see you have learned maybe some other lessons regarding this. So how cell membrane will produce different components. In our cell membrane we can see phospholipids, and it will be converted into arachidonic acid by phospholipase. Then arachidonic acid produce two things. One is cyclooxygenase, or called as COX, and the other side lipoxygenase. So lipoxygenase produce leukotrienes, producing some allergy reactions. Then arachidonic acid producing cyclooxygenase. So cyclooxygenase will produce three actions. One is production of prostaglandins, then produce thromboxane, and producing prostacyclin. So therefore, you learned about that pathway. Here you can see aspirin. So suppress the production of prostaglandin and thromboxane. As I mentioned you earlier in the previous slide. So you saw here the prostaglandins and thromboxane is produced with the help of cyclooxygenase. So example here you can see NSAID inhibition this pathway. So when somebody is using NSAID or preventive medication of cyclooxygenase, the prostaglandin production and thromboxane production will be reduced. So that means thrombus formation cannot be seen. Then that can cause bleeding. So therefore, when somebody is using NSAID, so bleeding tendency can be increased due to that, right? So here you can see when aspirin used, prostaglandin, thromboxane production will be suppressed, as I mentioned. So due to it is irreversibly suppressed, then due to that, without thromboxane, so formation of clot will be suppressed, and also that can reduce the inflammation. So low dose, long-term aspirin, especially noctadose, 75 milligram noctadose is used for long-term care for the people. So low dose long-term aspirin use irreversibly block the formation of thromboxane A2 in platelets, so producing inhibitory effect on platelet aggregation. So this antiplatelet property makes aspirin useful for reducing the incidence of heart attacks. So therefore, aspirin is a very valuable medication, and adverse effect, so increasing the risk of bleeding. Then we can talk about the antiplatelet component called clopidogrel. So when we consider clopidogrel, it is also irreversibly inhibit ADP receptors on platelet cell membrane. So which is important aggregation of platelet crosslinks by the protein fibrin. So fibrin will develop some crosslinks to form the mesh, but due to this, that crosslinks will not be formed due to clopidogrel. So clopidogrel does not have that much of gastric bleeding, that means gastric ulcer situations like aspirin. So therefore, this is commonly used currently than aspirin sometimes. So used to inhibit blood clots in coronary artery disease, peripheral vascular disease, and cerebrovascular disease. So adverse effect include hemorrhage again, severe neutropenia, thrombotic, thrombocytopenic purpura, kind of a rash, and aspirin and clopidogrel both are usually given orally, usually given as a noctadose. Okay, so dipyridamole is also a medication that included into the antiplatelet category. So that can inhibit platelet addition to the damaged vessel. So it's a different function, but giving the same action finally. So inhibit platelet phosphodiesterase activity, resulting in lowering intercellular calcium levels. So this is a potent vasodilator. So therefore, the blood pressure also will be reduced with this medication. So dipyridamole in some cases combined with aspirin given because further reduces the risk of stroke compared to aspirin alone. So it's a useful thing to know. So dipyridamole sometimes giving with aspirin. Then when we consider fibrinolytic medications, or called as thrombolytic medications. So if finally we even the patient use those medications, or without using the previous medications, the patient can get kind of fibrin formation. So if it is already produced, if thrombus is suspect already got the thrombus, so if it is confirmed, so person has to get a treatment from fibrinolytic, called as thrombolytic medication. So examples are first generation streptokinase, second gen alteplase, and finally found reteplase recombinant one produced from recombinant DNA technology. So when we talk about streptokinase, it's a protein secreted by several species of streptococci bacteria, can bind and activate human plasminogen. So this can activate human plasminogen. So therefore, plasminogen converted into plasmin, and plasmin can dissolve the blood clot. So uses acute coronary thrombosis. So that means in a myocardial infarction, especially we use streptokinase, and DVT, deep vein thrombosis, massive pulmonary emboli, plug AV shunt, or central lines. So we use streptokinase. So here adverse effects, especially bleeding. Then antibody production is the most risk thing. Then hypertension sometimes, and fever are the side effects. So antibody production, I'll explain something more. So here you can see contraindications. So previous intracranial bleeding at any time, stroke in less than a year, active bleeding, uncontrolled high blood pressure. So we are not giving streptokinase. And I told you about antibody production. So here you can see streptokinase is contraindicated in patients who have been previously treated with streptokinase, because I told you that can produce antibodies, as there's a risk of anaphylaxis is the main life-threatening allergic reaction due to production of antibodies against enzyme in the previous stage. So when they have the second dose, they may get anaphylactic shock, and a person can die. It's a really risk situation. So the second one I told, recombinant tissue plasminogen activator, or example alteplase. So recently in hospitals we are using this medication. So tissue plasminogen activator. So you see, it is produced in endothelial cells of the person. It is non-antigenic. So therefore, it is safer than streptokinase. Exactly, it is safe because it is not producing antibodies especially, and more selective thrombolysis than streptokinase. So therefore, much more valuable medication compared to streptokinase. So alteplase, and this is producing by with help of recombinant DNA technology. So here uses again myocardial infarction. We use acute cerebrovascular thrombosis, and pulmonary embolism, and central venous catheter occlusion. We use this medication. So adverse effects again, major bleeding, cardiac arrhythmias, anaphylactoid reaction. As I told you, basically they will not get anaphylactic reaction for this, but like streptokinase, but there may be. So cerebrovascular accident and intracranial hemorrhages are the side effects that can be seen with this medication. Then finally, regarding antifibrinolytic medication. So if the bleeding tendency is high due to fibrinolytic medication, then we have to administer antifibrinolytic medications also. So they interfere with the formation of fibrinolytic enzymes, plasmin, from its precursor plasminogen by plasminogen activator. So therefore, plasmin production will be uh, prevented from the plasminogen activators. So that is the action of antifibrinolytic medication. So they block the binding sites of the enzyme. So that means plasminogen activators, they are not this medication does not allowing plasminogen activators to bind to the relevant binding sites. So that is the way of stopping plasmin formation. and without plasmin, the bleeding tendency will be reduced. So example medication, tranexamic acid. So if the patient is in with high bleeding tendencies, we can use this medication. So you all got some knowledge regarding the medication types that we can administer for the different conditions regarding uh, blood clot formations and after clot formation, what we can do. So different medication types we discussed. So if you have any question, you can ask from me in future. So thank you very much for hearing.